All right, welcome back to another Altmed episode with my trusty co-host. I'm doing the intro this week, Andrew Dowling.
G'day, Mitch.
We have a fantastic guest, one we've been looking forward to having for a while now, Dr. Jim Connell, who is the co-founder and medical officer at Heyday Medical. So welcome, Jim, to the show.
Thanks for having me, lads. Great to be here.
Great to be had. So in terms of, we got a lot of things to cover today. It might, as we always do, benefit the listeners to start off with a little bit about yourself, a little bit about your background, how you got into the space, and why cannabis, why now, and all the rest.
All right, wonderful. Thanks, Mitch. So first off, I'm a GP, and I have been, always had an interest in chronic and complex disease management. I was passionate about palliative care and mental health, and chronic pain. And working within the regular general practice field, I was finding that the therapeutic tools that we had available were, effective some of the times, but were often only effective for certain elements of someone's symptoms or disease, and would often cause side effects in other areas. And they weren't treating the whole person, and they weren't necessarily. They were treating the pathology rather than the person, and weren't necessarily giving them a better quality of life by focusing in on those symptoms. So when I came across cannabis as a medicine, it piqued my interest because there was a void. There was a void in regards to the therapeutic tools that I had available to me. And I was very fortunate that in the practice where I was at was an early adopter of medical cannabis, and at the time. I think most clinicians out there believe that there were huge hurdles and administrative red tape to navigate to be able to prescribe medical cannabis, but he showed me that it was actually quite a straightforward process and gave me some names of different companies to start with, and then it just sort of organically went from there. And I, with my regular patients who I'd already had that long-standing sort of history with, I started prescribing some cannabis medicines. Really sort of started with CBD predominant treatments because I knew that was the most tolerable and I guess the easiest place to start. And started getting some good results and some bad results, and they were sort of mixed results. And I just wanted to know more why some patients were responding, why others weren't. And I just went down the rabbit hole, I guess, and it really just resonated with me the whole time. And I've been fascinated, ever since, and have been continually upskilling and educating myself. But as your listeners may have heard, my sister Phoebe McLeod, who's our general manager for Heyday, she described a story about our mother who had a diagnosis of stage 4 pancreatic cancer in 2020. And that was, I guess, took things to the next level for me. I became a little bit obsessive. I was already down the rabbit hole, but now I'm sort of lost in wonderland. And we got some really promising results with mum that really helped her through her journey. But through my extensive sort of research, there were so many elements that I wanted to be able to access to increase the complexity and hopefully the therapeutic efficacy of the whole treatment that just weren't available. And so that's what sort of, I guess, stimulated us to want to produce our own sort of products as well.
Yeah, it's an all too common story. Like people who have had someone dear to them or even themselves diagnosed with a critical illness, and then they have to undergo the huge learning, the steep learning curve there is involved with medical cannabis. And I can only imagine that for somebody who's not a GP, how much more difficult that would be, not understanding the complexities of how it interacts on a biological level. So, yeah. And did you find it, quite a big learning curve yourself?
It's been a steep learning curve. It's a way of approaching medicine that's different, I guess, to what we are taught through medical school. It's very much a functional medicine, and so the way that we practice at Heyday is that we want to utilize cannabis to reduce the burden of distressing symptoms, and that can be, you know, a whole range of different symptoms, but it's then about helping them engage in other health promoting activities that are going to upregulate and support their body's natural endocannabinoid system. So activating their own inner pharmacy, for want of a better word, to be working at its optimum, with the idea that, you know, people, you know, patients will get to a point where they don't need to rely on, you know, cannabis as well as other pharmaceutical drugs. They might just have it there on a as needed basis, or a top up, because their body systems are doing what they're meant to be doing and functioning at their optimum. So that approach is just, you know, just very different to what we're sort of taught.
I was going to say, just on what you were taught, I mean, coming through the ranks of, you know, med school and becoming a GP, do you sense that, you know, the curriculum at med school might actually be expanded to include more information for, you know, up and coming doctors about, I suppose, the use of plant-based medicines in Australia? Or is it still a topic that's deeply stigmatized and sort of something that would be left off, you know, any courses?
Look, we can hope that it's going to be included in the curriculum, but the curriculums are already pretty jam-packed, and, you know, something may need to give for, you know, plant medicines and the endocannabinoid system to come in. It's an area that is necessary because, you know, as you're aware, and the listeners are aware, the endocannabinoid system through which cannabis, you know, evokes a lot of its actions is incredibly important for all bodily systems. So to, you know, learn about the heart or the brain or the stomach or anything like that without understanding the endocannabinoid system as well, you don't have the full picture. So you know, even if cannabis and plant medicines aren't brought into the curriculum, the endocannabinoid system should be. But it's really divided out there. It's a really divisive sort of topic. You know, people, I think you have to recognize that doctors as well are people, and they have been fed the same prohibitionist stigma for their entire sort of adult life. So you're presenting scientific evidence, but you're, you know, banging your head against these, you know, biases as well that are pretty strong there. So it will happen, but I'm just not sure when it will happen.
How hard do you think it is for lack of a better term, a green doctor to get their head across cannabis if they've never prescribed? You know, there's a lot of doctors out there still say it's a whole lot of mumbo jumbo kind of thing, but one that is interested and wants to learn more, how long do you think it is before they're comfortable? What's that kind of pathway in modern times?
Look, I think that you know, varies between doctors. Ones who need to have, you know, many levels of sort of reassurance and safety nets before they prescribe, and others who would feel a little bit more adventurous in their sort of prescribing. But there's a real complexity around cannabis, but there's also a simplicity to it as well. So there's the complexity of the endocannabinoid system. There's complexity of the different cannabinoids, the minor cannabinoids, the terpenes, and these types of things. But on a prescribing basis, and with the products that we have available, the prescribing patterns can be quite similar across a range of different conditions. So, you know, I think you can start prescribing after, you know, a couple of weeks of, you know, in doing some decent sort of education and training, but your understanding and knowledge that's just going to be the starting place, you know, just to make sure you're practicing safely, but you'll be optimizing and fine tuning and refining your practice as you sort of go, and as the formulary expands as well, to, you know, to have products that are more nuanced or contain these minor cannabinoids or acidic cannabinoids, or, you know, varied sort of terpene profiles and these types of things. So I think it'd be a good time now to get into prescribing, because, you know, we've got a formulary of over 300 medications at the moment, but, you know, that's going to expand at some point to be thousands. And then we're potentially going to have, you know, specific sort of synthetic sort of analogues that work at, you know, particular parts of the endocannabinoid system. And I think that will probably fall into the realm of the, for want of a better word, sort of cannabis sort of specialist sort of realm. So I think we're going to, you know, our knowledge is going to need to expand quite greatly, but at the same time, to start prescribing, you can do it with a smaller amount of knowledge and be safe and generally get good results.
It's interesting when I hear you talk about it like that, the 300 products. I mean, when you think about other medications, even just some common ones that everybody knows, like paracetamol, it almost doesn't really matter what brand you get. You get paracetamol, if that makes sense. You get different, some are a bit easier to swallow and the rest like that. But we don't really see that range of diversity within that, say, THC product, for example. We know it's the other things happening around the THC, but there's real diversity in a THC product. Two flowers can be the same THC quantity and totally different effects.
Yeah.
How do you get your head around all those three? You're saying more than 300 products, but how do you even get your head around the 300 products right now?
Well, you can't fully, you can't, there's always going to be some variability, and there's always going to be a little bit of unknown. Mm-hmm. But it's about setting up an approach with your patients where you get them to have a reflective practice, and so they become attuned to the changes that are going on within their body as they're incorporating a certain medicine into their treatment regimen. And then it's about the clinician listening to that patient and listening to those experiences and sort of having an understanding if they're getting, they're not getting the therapeutic effects at a certain time of day that they would hope to, understanding that we can, enhance those effects by adding in certain terpenes, or if they're getting side effects related to certain elements of that product they're on, then we can sort of mitigate those side effects by adding something in. So you don't need to get it perfectly right first go, and it's sometimes not possible. You can have all the knowledge in the world, but everybody's endocannabinoid system is different. Their physiological context within, even if they have the same disease, their physiological context is different. And it's a complex herbal medicine, and so everyone does respond slightly differently. So it's about more setting up the practice around listening and reflecting, and then making adjustments based on what people experience.
A question then about, I suppose, your clinical observations with the patients that you've seen. I guess speaking broadly, we've seen different trends. I think when, more and more people were starting to become approved for cannabis medications, there was still quite a sort of preference or tendency for doctors to be prescribing oils. And we've seen, I suppose, the rise of flower being prescribed. What have been your observations around, oils and flowers, and what works, maybe what didn't work as well for patients? I know it's a bit of a tricky one because there's so much to unpack, but can you, at a very high level, give an overview of what you think works in your practice?
Yep. Yes, I'll give you, I guess, an overview of my sort of prescribing practice, and each doctor is going to be slightly sort of different, but we have this complex herbal medicine that has hundreds of different active components, and the way that those components are arranged and what ratios creates quite unique and varied medicines, which is great because it gives us this ability to choose particular products for certain types of day, because the time of day is going to be dependent on your functional needs and certain symptoms as well. But in general, people's needs at nighttime are to relax, unwind, forget, and rest, and put down their burdens and their pain. So THC predominant treatments are what I sort of employ more predominantly at nighttime. I find them more reliable in regards to those attributes. And then during the day, people need to be up, alert, focused, and cognizant. So CBD predominant treatments are generally, I've employed more through the day. And then there's always this sort of personal sort of balance between cost, efficacy, and functionality, and that sort of changes depending on someone's sensitivity to THC as well. THC is going to be the main sort of player there in regards to whether it's going to be impairing or not, but it also makes the medicine more powerful and more efficacious as well. So I'll start with generally a CBD predominant treatment during the day. If they have severe symptoms or specific symptoms that I know will respond better to THC, I'll probably put them on something like a balanced product. And then at nighttime, going to the more THC predominant and using the oils or the oral formulations or sublingual formulations for background symptoms. So they're like a slow release medicine, and then using flower for those acute symptoms, because most patients who have a chronic condition will have a background level of that. And then depending on the external factors or other influences might have a flare up or an acute exacerbation of their condition. And using a slow release formulation that takes 1 to 2 hours to work is inappropriate for that. So that's where the flower comes in. So it's often done in a very layered approach. And a lot of it's to do with the condition, but it's also to do with, the individual needs of that person and what they need to achieve in a 24-hour period. So that's my prescribing practice. The oils and tinctures are great because of the ability to titrate up in very small increments, so that you can, start at a sub-therapeutic dose and then slowly increase it, in that slow, mindful, reflective manner until people get to, their therapeutic window or their optimum sort of dosing range. And that's why they're good. And then the flower, is just the most complex version of cannabis. And the complexity of cannabis, I believe, gives it a lot of its efficacy. And to have that available for that instantaneous relief is a wonderful option as well. And it can be easily titrated as well, because you can just start with one inhalation, wait 10, 15 minutes, have another if you need to. So you can do it all slowly and incrementally to find some optimal dosing ranges. I think once patients are on an established dose for ease of use, ease of transportation, going to a fixed dosing sort of product, that a soft gel or a capsule or a wafer or something like that, is appropriate. But in the initial phases, often the oils are the easiest to find that, more precise dosing.
Yeah. And within those products, I guess, I heard you say it earlier. What are you looking for even more specifically? I heard you say the acid analogues, for example.
Mm-hmm.
So we're talking about other minor cannabinoids and CBDA and things like that. I know some of our listeners like to get a bit granular on these types of things. So please feel free to go right into depth with it, because we've talked about it a little bit on this podcast, but not as much about the acid analogues.
Yeah. So look, I guess the main cannabinoids that we're basing most of our prescribing decision around are the CBD and THC content, because that's what we have most widely available to us. But I'm excited for the future when we have all of these other elements as well available to us. Like, so the acidic version of CBD and THC are probably the most obvious place to start, because they're still abundant and readily available, potentially from the raw products that we have. So for the listeners who don't know, the acidic versions are the acidic versions are the naturally occurring sort of versions of those cannabinoids within the plant. They go through a process called decarboxylation to form CBD and THC. So that decarboxylation is most commonly done by application of heat. So when you have raw cannabis and you put it in a vaporizer, or you use a lighter to ignite it, then that naturally decarboxylates the THCA or CBDA. Most of the extraction, methods that are most commonly employed, CO2 and ethanol extraction as well, just through the processing, the decarboxylation will occur with those acidic cannabinoids, but they can be maintained through careful extraction processes or alternative extraction processes, or just using the raw cannabis without ever heating it. You can have access to both CBDA and THCA. And the reason you'd want to do that is so CBDA and THCA work differently than CBD and THC. So CBDA, it has very similar activity to CBD, except it's more water soluble, which means that it's much more readily absorbed. So there are studies that show that it has probably up to 55 times the bioavailability of CBD. It also has much stronger anti-nausea properties, up to 1,000 times stronger as an anti-nausea agent than CBD. And it also has some stronger anti-inflammatory properties as well, having some COX-2 selective inhibitor sort of properties, which is what your conventional NSAIDs use as well. One of the other differences between CBDA and CBD is that CBDA doesn't have that same negative allosteric modulation at the CB1 receptor, which means it doesn't dampen down the effects of THC. So often we use CBD for its own reasons, but also to reduce the intoxicating nature or the anxiety provoking nature of THC. So there's that synergy there. CBDA doesn't have that same interaction, and that can be beneficial for some patients who find that THC without CBD is more effective, but then you can add CBDA in as well to have an added benefit without dampening down the THC effect. So that's CBDA in a nutshell. And at the moment, I know that Phytoka have within their product some CBDA. But I often get
we don't talk too much about that on the podcast. We try to keep them as separate as possible.
Okay. Well, I'm sorry, I didn't mean to give you a plug against your will, but also I get my patients to make a lot of cannabis tea as well. So if they put a small bud in hot water for 15 minutes, because of the water solubility of the acidic cannabinoids, they'll go into the solution. So you can get it that way as well. And it's a nice herbal sort of type tea. And then THCA, which is the acidic version of THC. One of the main differences there is that it doesn't actually have the same direct interaction with the cannabinoid receptors. So it's non-intoxicating. It doesn't cause any impairment. And it works through completely different mechanisms, but it can be a really powerful anti-nausea agent. It can have really strong anti-inflammatory and immune modulating sort of potential as well. And there has been some reported evidence that in certain patients, it can be a strong anticonvulsant at very low doses as well. So it doesn't, it's in regards to that, it doesn't work for all types of epilepsy or all patients, but if it does, they can often get relief at very low doses. And one of the biggest issues at the moment with using CBD as an anticonvulsant agent is that you generally need to use very high doses for it to be effective. And that's not affordable long-term for a lot of patients, as it's not, subsidized through the PBS. So those two, excite me. And I think they don't need to be necessarily utilized on their own, but, in combination with CBD and THC, I think we could find, even a greater sort of ensemble effect there. And then obviously, some of those minor cannabinoids, your CBG and CBGA, I'm looking forward to the days when we have those readily available, as well.
A question on just availability. I know it's been a sort of a hot talking point for quite some time now, that it's actually probably cooling down a bit. But the talk of having an over-the-counter CBD product that people will be able to go to pharmacies and get directly. Just curious, from a doctor's perspective, assuming that product is likely to be a CBD isolate in a carrier oil, because I think it's got to be 98% or more CBD, and it's I think the TGA has set the limit of 150 milligrams daily. What types of conditions would somebody be able to sort of attend a pharmacy and get that type of product to treat? Is that going to be able to help many people, do you think? What's your take on those products?
Yeah, look, so yes, they need to be greater than 98%, CBD, but they can still have the terpenes and they can still have a very small amount of THC. So there is the potential for full spectrum products, going over the counter. They just need to be
less than 2% THC.
Less than 2%. So there are products out there that exist. So, more THC would probably make it more efficacious, but it's not going to be just isolates that get over the counter. And to be honest, for a lot of the patients that I treat, they're probably using less than that when they're using CBD, because any more than that, it's a financial burden. So that most of the studies that have looked at CBD that are out there have used very high doses of CBD, and that's where they've shown sort of efficacy. But from serious case reports and other specialist doctors in this area, overseas, you can often get relatively good results with lower doses of CBD as well. So just your general sort of stress often responds to quite low doses of CBD, 10 to 20 milligrams, a couple of times a day can make a big difference. Sleep related conditions, you might need a higher dose, and I'm talking full spectrum sort of products rather than isolates, because you often need more of an isolate to get the same sort of results. But you might need 40 milligrams or something like that in the evening for CBD. If CBD is going to be something that helps you with sort of sleep, so it's a slightly higher dose. The more severe pain or inflammatory conditions, you might need slightly higher doses. You're not going to be able to treat things like epilepsy at those doses. You're not going to be able to get the antipsychotic properties of CBD at those doses. But for a lot of the general conditions that CBD is utilized for, then that limit should be adequate to have at least partial improvement of symptoms. So it's from what I've seen, I think that will be a decent amount for most patients. The thing is, the reason it's not over the counter at the moment is because all the studies that have been done have been at those higher doses. These companies are now needing to prove efficacy, so they're having to do clinical trials, which is great. It's a great thing that we're having to do these clinical trials because at the moment so many people are just using CBD as a tonic, but there's no real evidence around it. So it's forcing our hand to build up that evidence base. And that's going to be great for cannabis as a medicine, in general, getting accepted by the wider medical community. So I think
it is hard though. It is hard though when you're doing clinical trials on products that can be so different to I mean, you can draw general inferences, but it really ends up kind of being product specific unless it is, let's say, an isolate. And I didn't mean to cut you off before. I appreciated the plug, but we'd try to keep everything a little bit more neutral for the integrity of the show. But, when you do find a product that is, say, higher in CBDA or CBG or things like this, if you do a clinical study on that product, not only may other products that are CBD dominant have a completely different profile, but potentially even that product might have a different profile the next time you do a batch. And obviously we're working towards the space where we'll have a lot of consistency in products, but as opposed to say oils where you've got a 10% leeway for the reported cannabinoids or any actives, you've got that kind of 20% on the herbal medication, so flower preparations. That's kind of indicative that each time it might be slightly different, if that makes sense. So yeah, what's your take on that?
I think it's something that we're never going to be able to fully control for. The variation, even if you have like the same exact grow conditions, the same exact nutrients that's put on there, the same lighting schedule, you're growing from clones that there's so many variables in the drying process, and and then in the extraction sort of process as well, and then just how it's stored, if there's exposure to light, heat, oxygen, any of those things along the way, then those products are going to change. I think it's great that we'll have a general, the general evidence base, but you're right, the specific products themselves are the ones that it's going to be most relevant to those outcomes. But I guess, we need to build the evidence base, but we also need to be aware that, we need to just continue listening to our patients. And if they say that something's not working, then it's time to change it up a little bit.
I've got a really good question. Sorry, I've cut you off there.
Yeah, that's cool.
I've just got a question. Before you're saying you need, say, for epilepsy, a much higher dose of CBD isolate to get near, say, a full spectrum product, your average full spectrum product. Do you think it's always the case where you can just up the isolate until you can get that effect from a full spectrum? Or do you think in some circumstances, the outcomes are not achievable from the other, like one is not achievable from another product?
Look, a lot of the time you can just continue upping the dose of the isolate, and you'll probably get to a point where you do, get similar results. But with those increased doses also come increased sort of side effects and increased chances of medication sort of interactions, as well as increased sort of costs. But there are some conditions where it does look like there is a ceiling effect with CBD isolates compared to a full spectrum product, where when you do continue to increase the dose, they get ongoing benefit. I've heard that through webinars and stuff like that. I couldn't tell you exactly what those conditions are at this sort of stage, but they do probably follow different sort of dose response curves as well. So normally with CBD, I'd say the more used generally, the more effective it is, because CBD is a medication that works on about 65 different receptors, enzymes, and neurotransmitters within the body, and it and it will activate different pathways at different doses. But there are some studies that do show a multiphasic sort of response with CBD. There are other ones that have shown some, a bit of a U-curve with CBD as well, which is where the low doses were quite effective, moderate doses became less effective, and it wasn't until you got up to really high doses again that it went back to that effectiveness, and then it kept going up. So it's a it's a bit of a strange medication to sort of get your head around. But yeah, most of the time you can get similar results. You just need to probably use about 5 times as much with an isolate to get there.
And how does your THC prescribing go? Are you cautious? Are you pretty free? Like what's your take? I know everyone starts off more on the conservative side and kind of loosens up over time, but where would you sit these days?
Look, I probably think as a beneficial medication, I think THC probably beats CBD most days for especially the more severe end of the spectrum. And I'm pretty, I'm liberal with my THC prescribing in that I do prescribe a lot of THC based medications, but in the way I approach it is the same for everyone, whether they're cannabis naive or whether they're an experienced cannabis user who's been self-medicating for a period of time. And that's to start at a sub-therapeutic dose, a dose below where they're likely to experience any significant positive effects or significant sort of side effects, and then every 3 to 4 days increase that dose marginally and get them to track their therapeutic response. And most people out there think that you need to feel intoxicated or impaired or stoned to receive the benefits of THC, and that's just plain wrong. There's a lot of therapeutic activity and therapeutic effects that can occur before that point of intoxication. So I talk about the therapeutic window with THC, and it's probably most relevant to THC. And what that means is the therapeutic window is the point where you start getting benefit to the point where you start getting side effects or intoxication. And the closer you get to that point of intoxication or side effects, often the better efficacy you have. But once you get to that point, that's the point where you stop at. You don't really get any ongoing benefit. When you consume more THC past that point, you just become more intoxicated. And that intoxicated effect can be beneficial for certain things. It can help people sort of forget trauma, and it can be great for PTSD, or it can help them sort of deepen other reflective or meditative or yoga sort of type practices, or it can even have a spiritual element to certain individuals. But the beneficial effect of that intoxication actually reduces the more frequently you experience it. So when you're using THC, you should be using it as a medicine at a point before intoxication. Experiencing those intoxicating effects can be of benefit, but you should be reserving it for special occasions, or to actually try and work use the medicine to help you work on certain things you're wanting to achieve.
Yeah, I save it for special occasions like my birthday and
yeah. Seem to have a special occasion every week, Mitch. But and just on that point, so chronic intoxication through THC from a doctor's perspective is really is it likely to build your immunity to those effects such that you actually are going to then need higher and higher doses of THC to reach that same level of intoxication, were that to be the goal for some users who are perhaps, for trauma or any other reason, maybe wishing to sort of break into that zone?
Yeah, so the more you spend over this side, once you go past that optimum dose, the more you spend, intoxicated, the more likely you are to build tolerance. And that tolerance occurs because your body's own endocannabinoid system is being continually flooded with excessive amounts of cannabinoids, so it becomes lazy, and those receptors that are there to attach to the the circulating cannabinoids go back inside the cell. And so building tolerance means you're going to need to have escalating doses of THC to have the same effects. But it also means that when you don't have cannabis on board, your body's own, in a pharmacy, your natural endocannabinoid system is not going to be able to work as effectively as it as it should. And therefore, when you don't have cannabis, you become dysregulated in regards to being able to control your stress, your pain, your mood, your sleep, digestive issues, and all that kind of stuff. And that's what you see with the withdrawals from cannabis is a lot of those symptoms. And that's it, because your endocannabinoid system has been made sort of down-regulated or dysfunctional. So there's two elements to tolerance. There's a tolerance to the intoxication, and if you're chasing the intoxication, then you're likely to build this, I guess, bad tolerance, we'll call it, where you could potentially be dysregulating your endocannabinoid system. But there's also that point where you're getting some mild sort of side effects, some mild impairment. And if you stay on that dose consistently for a period of 1 to 2 weeks, you'll probably get a tolerance to the side effects without building a tolerance to the therapeutic effects as well. So there's, I guess, two different types of tolerance there. One's beneficial and one's not.
What about, have you ever considered prescribing, say, you prescribe CBD isolate oil. Have you ever considered prescribing, say, CBG isolate oil? Something like that, CBC, CBN, something like that.
Yeah, look, I'd consider it. I'd prefer to have a full spectrum CBG product.
Sure.
But if that's all I had available to me, then yes, and I'd probably incorporate it into my prescribing practice. I'd probably use it in the place of CBD for patients who find that CBD makes them feel a little bit anxious rather than relieving their anxiety, because it's probably more relaxing. Those who have metabolic dysfunction, CBG can be really beneficial for helping with people's blood pressure and blood sugars, as well as incorporating into patients who are undergoing cancer, and using cannabis to help them in their journey, because CBG does seem to be often the ingredient that's in certain sort of chemovars that makes them more effective, in regards to their anti-tumor sort of properties. So yeah, I'd add it into the spectrum. I wouldn't necessarily prescribe it on its own.
Right. Okay. And do we dare even go down the CBGA and CBCA territory?
Yeah. Well, look, I think there's probably going to be so much that we unlock and learn around these as well. And there's lab-based studies and there's animal studies, but there's not a huge amounts of evidence in humans. So
yeah,
but I think that that's only going to increase, over the next 10 years.
There's plenty of research to be done. And if you ever require any patients for that research, Dr. Jim, I know 2 guys who would be interested. I'll put you in touch. No, I haven't seen a CBG dominant full spectrum oil, or for that matter, any other of the minor cannabinoids playing the role as sort of the lead dominant cannabinoid in a full spectrum. Yep. But certainly in terms of from your prescribing perspective, are you seeing more and more full spectrum oils becoming available? Is your sense that, you've got quite a limited selection of good full spectrum oils, or are you, what do you look for, and what's your sense of what's out there?
So there is a decent amount of good, I guess, what do we classify as full spectrum? I guess is the first thing. And there's a lot of products that look like they're the same product, but depending on the chemovar that's gone in there, and then the actual extraction process and how much care they've taken in that extraction process is going to lead to a bit of a different product. But look, to be honest, I don't really look at the isolates. I only ever look at the full spectrum sort of products, or the broad spectrum, for those who in regards to the driving sort of implications. But there is a decent amount of similar full spectrum products, but we're sort of lacking, differing sort of ratios of CBD to THC at a bare minimum, and then having these significant components of these other elements that I'd like to sort of see. And it'd be good to have better terpene analysis of the finished oil as well, because we get a terpene analysis sometimes of the flower that's gone into producing that oil, but there's so much that's lost through the extraction process that what you get at the end is going to be very different to what went in, and it'd be nice to know exactly what came out at the end as well. And then we'd really be able to see who had the most full spectrum sort of oils as well. But it's not really
available yet. We're all for that. Yeah, absolutely. Just wondering, so in terms of now translating all of that's in the plant to your actual clinical observations, I know that you have a bit of interest in, as you said, complex chronic diseases, potentially palliative care and mental health. What kind of outcomes do you see in those indications in your everyday practice?
Look, the more complex the patient is, the better result I generally see with cannabis. Because if you just think about it from the endocannabinoid system perspective, which is how I like to bring everything back to the body's own natural endocannabinoid system, the more dysregulated their endocannabinoid system is, the more areas they're going to be having issues with. So if someone has difficulty with their pain, with their sleep, with their digestion, with their mood, and other processes, then it's likely that there is a significant endocannabinoid dysfunction there. So then when you're adding in cannabis in the right way and you're using that cannabis to tonify and upregulate the endocannabinoid system, it can have profound benefits. And also when someone has all of that symptomatic burden, you don't need to completely fix their pain or their sleep or their mood for them to have a major improvement in their capacity to function in daily life. Because if you can help their mood, their sleep, their pain, even a little bit across the board, then you can have putting all those together, you have a major improvement in their ability to function. So the more dysregulated they are, the better the results often are with cannabis. But palliative care can be really profound, not just from the symptomatic management, but to help with acceptance, to help them to actually sort of be able to face what's to come, and then be able to communicate that often to family members without the distress. And so it can be really beneficial, not just for the patient going through that journey, but for the family as well. And mental health is a funny one where it can be really beneficial for mental health, but if used correctly, or if in the wrong person, it can exacerbate it and make it worse. So that's why it's really important to start it, have that sort of prescribing practice where you're starting low, you're increasing, based on that person becoming attuned to their body and that reflective practice. You want them to be setting, intentions with their use as well. So, rather than just utilizing cannabis to try and be not anxious or to have no pain, I try and get people to think, okay, I'm going to utilize cannabis to reduce my pain or my anxiety to a point where I can then engage in other activities. And that might be going for a walk, it might be just enjoying, natural surrounds, it might be doing some breath work, it might be doing some meditation. And so you're getting them to engage in other things that are going to be beneficial for their condition as well.
It's interesting. I was thinking about it the other day, and sometimes you come across people maybe from the more alternative space, let's say, who are like, everything's just interconnected in the body. It's holistic health, and it's kind of not really based in much. I feel like the endocannabinoid system brings some kind of science to that
brings clarity to all of that.
Do you know what I mean? And I think that's why it really appeals to people who are potentially against traditional Western medicine, let's say, but are still feeling like it kind of is that cross section between Western medicine now becoming more mainstream and alternative medicine, let's say. And I just think, that endocannabinoid system really brings the science to that, the gut's connected to your brain, connected to your, so it's, it
is like, it's the cellular communication network between all of these things. And the gut brain, the gut brain access, that's the endocannabinoids really that are helping them with that communication, from one to the other. And it does it. It's a holistic approach because it's a system that's everywhere, but it allows us to use our targeted sort of thinking patterns, because we can focus in on one area that has a holistic outcome rather than being overwhelmed by all the little bits and pieces that we need to do. We can treat someone holistically, but be targeted at the same time, which I like. Keeps things simple for me.
Yeah, and I hear a lot of doctors say that it removes the need for polypharmacy, like where you have, different, I guess, different medications that might be treating the symptoms of potentially other medications, and these 2 or 3 or 4 pronged approaches to medicine, where each one has its own benefits and downsides. Whereas it seems like cannabis has less of the downsides than maybe some more pharmaceutical, let's say, drugs on the market.
Well, you think where this complex, interconnected, the network of different sort of systems that are all connected. So when we're using monomolecular medications that are targeting one area, it pokes this area, but it causes an effect over here. Whereas cannabis is more, gently shifting the whole network towards a certain sort of outcome, and it's upregulating the regulatory mechanism of the body. So if it was going astray, it naturally brings itself back into balance in a way. And because it is a complex herbal medicine as well, it's sort of there's a type of medicine called network pharmacology, which is using lots of low doses of lots of different sort of low dose medicine, low dose of lots of different sort of compounds to work across the network, rather than trying to sort of pick one area and sort of blast it with excessive amounts of force. And cannabis sort of innately sort of does that, but it's a type of thing that they're trying to sort of implement with other sort of pharmaceuticals as well, where they're using an array of low doses of normal conventional medicines to have an overall effect, rather than targeting sort of one area. But yeah, network pharmacology is sort of how it works, and it's an area that's sort of expanding in the regular sort of clinical realm as well.
I'm going to take a stab at an analogy because I was thinking about it as well the other day. I was talking to a friend who's a big gym junkie, let's say, and I was having a debate with him between whether you train for a sport, high performance sport, and you grow muscles as a result of pursuing that sport and they're ancillary to the function, versus going and just sitting there and pumping your bicep, and you might not have strong legs or the connective tissue, and you're not training anything else. If you've got just this kind of out of proportion muscle being targeted in one way, is that kind of, I don't know if it's the exact analogy, but it kind of came up in my head the other day. I
like it. It's sort of like a lot of pharmaceutical medications have skipped leg day.
Yeah, exactly. And cannabis includes leg day. Exactly.
That's right. So
in my experience, it's always been legless day, but I guess you could say that. Yeah, it's possible.
You got to find that therapeutic window. It sounds like.
Yes, and jump out it. Andrew, I think any other questions for Dr. Jim while we have him? Otherwise, I think we've extracted quite a bit of wisdom today.
Well, the only thing is more, I suppose it is a question, but we are recording this prior to everyone in the world of medical cannabis converging on the Sunshine Coast for the United in Compassion conference, which the lovely Lucy Haslam is putting together. It's been on a bit of a hiatus with COVID and getting rescheduled, but it looks like it's finally happening. I was going to say rain, hail, or shine, but there's not going to be any shine at this rate. It's just rain,
just rain and hail.
Yeah, hail. But no, we're really looking forward to it. And my question, Jim, is can we catch up with you for a beer while we're at UIC?
100%, mate. I'm going to be there. I'm going to be even though I live in Noosa, I've got a rental down that way, so I can enjoy myself without having to worry about transportation. So
well played. Sure. We are looking forward to it. Looking forward to meeting you in person and Phoebe and the whole gang. So
likewise.
should be a great weekend. But
I never think of it as down that way. I always think it as up that way.
Yeah. It's all a matter of perspective. But no, thank you so much, Dr. Jim, for coming on and just sharing all of your insights. It's hugely helpful. I know there was something in that conversation, both for people just beginning in the space and trying to learn a few things, and also some of the more experienced patients or just people interested in the space. So thank you so much.
And people skipping leg day as well.
And people skipping leg day, exactly.
Let's skip leg day.
All righty. Well, until UIC, take care, and we'll see you soon.
Cheers, guys. Really appreciate it.
Thanks, Jim. Appreciate it.
Talk soon. Bye.
Bye.